Okay, we're here again today to do some more orthopedic testing, and we've done the cervical spine, we've done the shoulder, we've done the elbow, and now we're going to do the wrist. Same type of sequence as we've done before. We're going to do active range of motion, overpressure, resisted, joint play, and palpation. Okay, Fatty, so this is Fatty's affected side. We test his unaffected side first, and the first movements we're going to have Fatty do is flexion of the wrist. And right there I'm going to do overpressure. Now I'm just going to have Fatty bring his arm out here like this, so the arm is straight and it affects those muscles a little bit more. Overpressure there, and do extension. Good. And overpressure here. Great. Now, Fatty, could you do supination for me? Oh, you've done supination. How about pronation? That's great. Good. And a little bit overpressure there. And again, there's a combination between testing the elbow and the wrist and supination this time. Great. A little bit of overpressure right there. And we're checking out the distal radial ulnar joint. And now, could you do ulnar deviation for me? Perfect. Yes, that was a guess for me too. Overpressure here and a radial deviation. Good. And a little overpressure there. Great. So what I want to do now is some resisted testing. We've done active range of motion, overpressure, and we've checked out the wrist, the radiocarpal joint. And I'll do some resisted testing, and I think I'm going to have you laying down for that. Okay? Could you just lay back for me? Great. So you notice there's a crossover between the elbow and the wrist because these muscles are very much co-related. And what we're going to do first, I think, is have Fatty resist my movement in flexion. So I'm going to go in this direction, just resist my movement. Okay, 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. And I'm just going to have you turn your arm over. Keep your hand right there. I'm going to push in this direction. Ready? Ready? 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. Okay, so let's do supination and pronation like we've done before. We're going to do it again. I'm going to move you in this direction. You resist my movement, so I'm going to move you towards pronation. Okay, ready? 1, oops, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. And let's go into supination. Ready? 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. Okay, we've done several of the movements. We want to do ulnar deviation and radial deviation. Could you move over just on the table toward? That's good right there. Great. So I'm going to try to move you in this direction, which is I'm going to try to go in a radial deviation. Just resist my movement, okay? 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. And okay. So let's try to do ulnar deviation. Ready? 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. Good. So we've checked all the major muscles of the lower forearm, the flexors and extensors, and we've done overpressure on the wrist. And so what we're going to do now is do a little joint play on the wrist itself. So we're going to be doing anterior and posterior glides and medial and lateral glides. Okay? So the first one here, and I think everybody can see this, I have a little support system here that I apply pressure down here, having support. I do a little distraction, and I do anterior glide with the wrist, a sustained grade 2. And from there, I'll do that a couple times to get a sense of feel of the tissue. And then I'm going to do a posterior glide a couple times, a sustained grade 2. Good. And one more time. Good. And I'm just going to have Fatty move his arm in this position. And again, I'm very much supporting the wrist the same way as I had earlier, and just let your wrist relax. Good. Great. A little distraction, a glide there. I'm going to hold that, relax, and perhaps you can see a little bit better here, and a glide there. And one more time, a little distraction and a glide. And to end this off, I'm going to do one more glide in a lateral direction, upward, and relax, and up. And one more time, sustained grade 2, and up. Good. And to end off the palpation, again, the palpation will be of the forearm Again, you're looking for lesions, myofascial trigger points, contractures. You're palpating for any kind of strange or unusual tension, tone, or texture. And the inside of the arm too, down the forearm flexors. And then you can take a look at the hand, take a look at the flexor retinaculum area, testing out and spreading that out. The pollicis muscles and the hyperethenar eminence muscles. And generally looking at the hand and making sure that there's good movement and flexibility in all the fingers as well. Okay? You can also do joint mobs on individual fingers if you choose to. The metacarpal phalangeal joint, you can simply do joint mobilization by stabilizing the metacarpal and doing a little distraction, an anterior glide or posterior glide on the individual fingers depending on what area is affected. Okay, and that ends the wrist and hand, and we'll move on to the lower back.